Next, we'll want to invite Sarah Young, Director of Strategic Initiatives. This is another information item.
Thank you so much for the momentary pause as I am making sure that I'm sharing not just in a Zoom, but also on the screen here for you today. My name is Sarah Young, and I am your Director of Strategic Initiatives. I appreciate the opportunity to be here in person to provide you an update on our COVID-19 relief funding for K-12 education. So just as a friendly overview and a reminder, when we talk about the COVID-19 relief funding that's here for K-12 education, we are talking about a significant number of different federal awards as well as pass-through from the state level to K-12 education from federal funding related to the mitigation of COVID-19. So noting that some of these different awards came at different times, we like to provide you updates related to our oldest award, then moving forward to our most recent award in terms of the American Rescue Plan. So as an update related to our eldest award, or the CARES money that we originally received in May of 2020, this is going to be our ESSER 1, or Elementary and Secondary Schools Emergency Relief Fund, as well as our Gear 1 funding, which is the Governor's Education Emergency Relief Funding as well. This table provides an update related to where we are as of July 21st in terms of the total award values in these different sub-grant categories in terms of reimbursement that we have provided direct to the LEAs for services and plans that have been approved through the Utah Grants Management System. I'll highlight two specific updates. You will notice in our prior presentations that the only category in red was K-12 broadband, because that opportunity had closed in December of 2020. We now have more of those grants that are represented in red, which are K-12 PPE, the San Juan Wi-Fi project, and the high school testing, which refers to the funding to support COVID-19 testing for the Test to Stay and Test to Play initiatives that occurred in the winter of 2020. All of those have concluded at the end of the fiscal year. They were funded by state coronavirus relief funds. And so we are in the process of just closing out those specific awards, which is why they're now highlighted in red. You'll note that the K-12 coronavirus relief funding that was specific to classroom enhancements as well as equipment is still highlighted in green. That is because the governor's office provided our office an extension, noting that our partners in San Juan had some additional expenses in terms of receiving all of the radios necessary to be able to continue to support their broadband efforts, which they were using that funding stream for. So that one is still in green. We have until September 30th to be able to request full reimbursement. As far as our second round of funding, this is the CRISA funding, or the supplemental act to the CARES Act that we received in December of 2020. This is where your ESSER 2 and Gear 2 awards are as a part of the process. Just as a friendly reminder, these were awarded to the field in April of 2021. 90% of the funding is distributed through ESSER directly to our LEA local plans, and we saw the majority of those local plans focusing on addressing accelerated learning, or the learning needs of students that may have been interrupted or hampered due to the pandemic, the purchasing of educational technology, and the implementing of summer learning and supplemental after-school activities. We do like to highlight before we share our numbers for ESSER 2 that an LEA is required to request all of their reimbursement for ESSER 1 before they start requesting reimbursement to the ESSER 2 award, and that is not the case for the upcoming American Relief Plan ESSER funding stream that we'll talk about here shortly. So you can see related to ESSER 2, the reimbursable values are going to be lower, and that is to be expected, noting that many of our LEAs are still in the process of fully expending their first round of ESSER before they start to tap into these funds. Gear 2 is coming soon, which I'll talk about here in just a moment. And then we do have our EANS program. This is our emergency assistance for non-public schools. It was requested as part of the Secondary Act that the SEA, or or USBE, take over the provision of equitable services to our non-public school partners as opposed to those being provided by the local LEAs, noting challenges in capacity in responding to COVID. So we do have awards in that area and are starting some of the reimbursement process related to servicing those schools. As far as the update related to Gear 2, we do have outcomes related to the governor's direction on where these funds are going to go. Specifically, over $12 million is going to our LEAs in a formula fund in terms of providing services for special education and at-risk students. And that will be coming in the Utah Grants Management soon. We will follow a similar process as before, where an LEA submits a plan related to how they're going to use the funds in alignment with allowable use cases at the federal level, and then those plans are approved and an LEA can seek reimbursement. In addition to that, the governor is also directing that $968,861 of gear is going to be awarded to the University of Utah Reading Clinic to be able to support them in expanding their services to students and families who have needs due to COVID-19. So the governor has that opportunity to be able to identify some of those needs, and we as USBE serve as the fiscal agent then in the administration of that award. Last but not least, we have EANS, which we mentioned before is in the process of award. We have 23 schools that are currently projected to receive over $16 million in equitable services. And that is something that's being administered at our office in terms of the provisions of support. So last but not least, we have our American Rescue Plan Act funding. This is the funding the state received in both March and then ultimately in June of 2021 to be able to support ESSER ARP, commonly known as ESSER 3, but it technically has a slightly different name, and then the opportunity related to a second round of assistance for non-public schools in EANS 2. So friendly reminder, this is our largest award. It's over $615 million, 90% of it flowing directly to the LEAs in the required formula fund. The state reserve does have very specific requirements this round in terms of 5% to address the accelerated learning needs. That is over $30 million that will be ultimately decided by the school board in terms of how those funds are applied to be able to respond to needs due to COVID-19. In addition to that, 1% for evidence-based summer enrichment programs and for comprehensive after-school programs. I'll touch on that opportunity here momentarily because that is a competitive formula grant that is currently available for application. I'm pleased to let you know in person, I know you all heard via email, that the Utah ARP ESSER plan was approved. And so Utah was one of 6 states and as well as Washington, D.C., that was awarded on July 7th in terms of receiving the full value of our projected ARP ESSER award. And taking action in that space, the Utah State Board of Education has updated the grants management system, so the full award values are reflected to every single one of our LEAs, and that is what they're applying for with their local plans. In addition to that, I'd like to update the board that we did update the due date for LEAs. Originally, it was August 20th. We have extended that to September 17th. This was requested by many of our LEA partners in our consultation and technical support, noting they needed a little additional time in terms of meeting the requirements for both the stakeholder input related to the plans as well as local board approval. As far as the after school and summer learning funding, again, we have combined those opportunities at the state level into a single competitive grant opportunity. This was very intentional in terms of wanting to create existing partnerships that are not just during the summer, but also continue through the school year to be able to increase supports and capacity for supporting students and families beyond a traditional school day. The agency has over $12 million available in competitive grants, and that can support work from the time of award all the way through September 30th, 2024. It does require a partnership with a community-based organization or a local business. The local business was added in response to public comment from our rural partners who felt like that those may be more sustainable and likely partnerships for them to to be able to participate in this opportunity. The application is competitive and it is due to the Utah State Board of Education currently through the grants management system on August 20th, 2021. It'll then be going through a competitive review process, and we will bring outcomes to you related to that review. As far as other activities that have been occurring here at the office, USBE has been offering weekly technical support opportunities to your LEAs. This included doing an overview launch that we provided and recorded and placed on the website for all of our LEAs to be able to visit related to ARP, the application, and what the requirements were for each of our LEAs to qualify for this award. In addition to that, we've been hosting weekly office hours every Thursday at 2 p.m. Where we not only address questions that are posed in that live session, but we also collect the questions that we've received via email from the other LEAs, and we put them into a slide deck that then becomes a community resource to help further support our different leaders in the process. We also regularly respond to individual questions via email in terms of being able to make sure that our LEAs have the support necessary to be able to complete this process. As a friendly reminder, this award timeline started all the way back in March of 2024. As an agency, we are to the LEA application phase, and that is really the last phase of administration at the office before we move into a reimbursement setting. That is important for us because that's at the point where our schools and our teachers and our communities have access to reimbursing those funds, and it's really important that we as an agency get those opportunities validated and awarded to the community so they can take those next steps confidently in their plans to mitigate COVID-19. Additional USB action staff that I'll highlight as we kind of reach the close of this presentation. We have been providing LEA support in terms of the closing out of coronavirus relief awards at the end of the fiscal year. Very busy time for our business administrators across the state, and we really worked hard to make sure that there was a lot of correspondence and communication that those funds were expiring. So we're really proud of the amount of reimbursement that was ultimately requested and approved for the field. And it was definitely a partnership between this office staff as well as our BAs across the state in terms of making sure that we weren't leaving money on the table. The second item is partnering with the governor's office staff on the Gear 2 awards as well as the EANS program decisions and next steps. There is a secondary EANS ARP award that is available for application if the governor of the state of Utah decides to do that. USBE would again serve as the fiscal agent. So we're just working through some of those logistics and planning efforts with that team. In addition, we've been working with the Utah Department of Health to determine some of the additional PPE needs that may exist for LEAs in fall of 2021. Your office staff work very closely in terms of helping to make sure our partners at both the Department of Health and the governor's office have the appropriate data in terms of knowing how many students and teachers to expect in the schools and different LEAs, so that as they move forward with those efforts that they have and are using the correct data to make plans in terms of that distribution effort. Fourth on the list, we have the U.S. Department of Education's Maintenance of Equity reporting for USBE. This was completed by Director of School Finance Patrick Lee. He and his team submitted this to the U.S. Department of Education. It's an analysis of our schools that basically looks at the amount of per pupil student funding in comparison to the poverty rates and allows us a baseline in terms of being able to report the amount of funding that those LEAs receive per student at the state level that ultimately is a commitment for ARP that it will be maintained, or if it is decreased, that it is not disproportionately increased to those LEAs as comparative to the larger community. Last but not least, we have started the review of the reporting requirements. The U.S. Department of Education has released draft reporting requirements for ESSER Gear and EANS, and staff are looking at it in terms of what existing data sets we have at the agency to be able to report those directly before we seek to potentially have to gather information at the LEA level. These are new reporting requirements, and so it's definitely an analysis and a process before we reach a point of being able to report out on what those requirements are going to look like and where the data is coming from. As far as the state transparency dashboard, we'd just like to remind everyone here, not just with the board, but members of the public as well, that we do have a transparency dashboard on our coronavirus website for the agency. This is where you can find more information about the awards and the reimbursement values that have been provided to our local LEAs. We are also intending to add the ARP ESSER awards within the next 6 weeks once those move into an approved status. And we are working with the Utah Grants Management System and have issued those awards to be able to more accurately report to board and policymakers about how those funds are being specifically coded to the different allowable use cases at the federal level. Just allows us to be able to report that information to you without needing to go back to the LEAs and requesting yet again another response. Final update is just our timeline for the state set-aside determinations. I did reference the $30 million that is going to need to be decided as a part of our response for how we are addressing learning needs for accelerated learning. In working with our staff, we do expect to have early student performance data available next month as well as in October. Those will ultimately be presented to you as a school board through Assistant Superintendent Darren Nielsen in November. And then later in November as well as early December, we will be working with you to make decisions about how you want to apply those remaining state funds to be able to address some of those outcome needs. They may not all be specific to just accountability and response to that, but that is kind of the timeline we presented and that we look to proceed with moving forward. With that, I appreciate the opportunity to provide an update and I'm happy to answer any questions.
Sarah, we have several lights, but we actually have a time certain. So those of you who have lights on, will you write your questions down so you don't forget them? And then we'll bring you back to the table after our time certain. Sarah, will you be available again? So if you don't mind, so that we can stay on track with our time certain. Okay, we actually are having the Utah Department of Health Disease Plan for Schools presented by our state epidemiologist, Dr. Alicia Nolan. Did I pronounce that correct? Are you Dr. Nolan? Okay, Tiffany, were you going to do some introductions too or not? I don't need to. Okay, so go ahead. Are you ready?
Yes, I am.
Okay, if you'd introduce yourself, then we're ready to go. Thank you.
Yes, thank you. Thank you all for inviting me here to talk today. I'm Dr. Alicia Nolan. I'm the state epidemiologist and here to talk to you about our COVID-19 school plan for this coming year. So as you know, we have shared goals here. Everybody's trying for the same thing, and the main thing is to keep kids healthy and keep them in school. But at the same time, we have to make sure that we're mitigating the spread of this disease while they're in classrooms. And so really, we're working to get kids back to school in a safe way. So during this talk, I'm going to go over a few things. I'll look at the trends right now of what's happening with COVID, specifically in school-age kids, so you know what we're talking about. Talk about our roles, all of us as stakeholders, and then talk about the plan that we've put forward as the Department of Health, and then looking forward to your feedback and questions. Okay, so the data. So this is from June of last year to August, well, two days ago of this year. And you can see we saw that big spike in the middle of winter that we all saw. That was very prevalent. But unfortunately, we're seeing the trend go up again. And this is specifically school-age children. So we are definitely seeing cases increasing in our school-age children. We're seeing cases throughout the population because of Delta variant. It's hitting our kids too. And so if we take and predict what we expect is going to happen, these modelers who use math can tell us that we should expect somewhere between an even number of where we are right now to even 4 times as much. So we expect by October these numbers to possibly go up quite significantly. So we think there will be quite a few cases in the K through 12 age group. So if we look at overall cases in the 2020-21 school year, so last year, we can say we had over 39,000 cases occur in school settings. And so people were affected were included teachers, 3,700 teachers, students, and then there were other people who we just never were able to trace down exactly how they were or what their relationship was. But we know there were a large number of cases last year. And even in these last 2 weeks, we are seeing cases in schools and teachers, students and teachers. So I know that everybody hears COVID mostly affects the older adults, but the truth is it also can have significant impacts on children. So we know 82,000 Utah children between 0 and 18 have been diagnosed with COVID. 752 of those had to be hospitalized. 46 went to the ICU, so really not minor illnesses. And then 82 of them had this really complex diagnosis of multisystem inflammatory syndrome, where it affects really many organ systems and causes really significant disease. If we pull out the kids who were in the K through 12 age group in there, they represented 92% of all those cases, 81% of the hospitalizations, 78% of the ICU admissions, and 67% of the MIC cases. So these kids are being affected, there's no question. And we, luckily, this last summer, well, spring really, we were able to start offering vaccine to people who are 12 and older. You can see here how many kids have gotten their first dose of a vaccine up till now. You can see we have a statewide percentage of about 40% of kids between 12 and 18 have gotten their first dose of a vaccine. But some counties are a lot lower than that, some are a bit higher. And when we look at overall what is happening both across the US and here in Utah, unfortunately that map is very red, and red means we have high transmission. So we're seeing it throughout the United States and definitely here in Utah. We're having a large amount of COVID transmission. So we expect that when we get back to having kids in school, this is going to really affect how many kids are affected. Okay, so what is our roles of that was the data. So now what is the roles of what we're all meant to do in this response, right? So the public health department, we're supposed to prevent disease. So we're supposed to control epidemic infections and communicable diseases. And this is written into law. We're supposed to work with healthcare providers. We're supposed to work with schools. And we're supposed to now be mandated to hold to that 2% threshold that's the test to stay. And then we're also supposed to work with the local health education authorities to do the test to stay testing when the threshold is met. So on other levels, what are the schools mandated to do? So the legislature has a mandate that schools are required to report to the local health department any individual suffering from or suspected to have a disease that is communicable, which would, of course, include COVID. And then the local education authorities have clear directive as well to do make sure that school is happening. We want in-school learning. They also are required to do this 2% threshold, and we do have the legislative mandate saying that schools cannot mandate face masks. So where are we in how to do this? So we know that CDC put forward recommendations that are really quite aggressive and really trying to control infection as much as possible. And then we have the 2% threshold, which I think everyone who has looked at the data suggests that when we hit 2%, it means things are kind of out of control. It's past where we can really get things back under control. Last year's guidance where it was all students mask, really sort of put us a little bit over on the end, so we were more protective like the CDC guidance. And so what we're trying to do is figure out where we can be in this balance to still protect children, but also recognize Utah's desires of how they want to participate in school. So what we're trying to do is really make this standardized. So the Department of Health has hundreds of disease protocols where we describe how to respond to a case of salmonella, to a case of Ebola, and it's standard. We have all these different standard protocols. So we feel that we should just standardize COVID so it isn't something unique and dramatic. Instead, it is like all the other diseases we respond to. So what plan did we put forward? So we wanted to go for a simple plan. We know schools have been really burdened with having to do all this complex testing, complex contact tracing. So we want to minimize the burden on schools, but at the same time, we want to do the duty to protect health. And we also recognize that we want to keep it so that people do not need to have long-term mask use if they choose not to. And we want to give parents choice. So with that, we have published a plan on our website that you can look at afterwards, but I will go through it now. So really, overall, we are recommending the layered approach that's consistent with the CDC guidelines. And we have that up on the website that discusses all the different ways that families can choose to protect their students. And it also goes through things like social distancing, maximizing airflow in classrooms, things like that have already been in place in the last year. And we have put those on the website because they are the best protective measures. But at the same time, here's the list of things we have recommended, which I think probably all of you are familiar with. The one thing that did get mandated last week by the federal government is now we have information. Oh no, the slides went away. I can see them. Oh yeah, that is small. Difficulties with technology, always the hardest part sometimes. Should I go back with slides, or are you guys all okay with where I am? Okay, Okay, so I'll go back to the different recommendations that I think many of you are familiar with from last year. I mean, the main one we're really recommending is that people who can get vaccinated, and that's really important. We know the vaccine's the best protection. But at the same time, we are saying the best protection is also do indoor masking, social distancing. We want to encourage screening tests if anybody ever has symptoms or is likely exposed, but also go to those other levels of getting cleaning in the schools, ventilation, encouraging hand washing, and then everyone remembering to stay home when sick and get tested. And so then last week, CDC put out orders regarding public transport, and that does include school buses. So that does require all schools, passengers, and drivers, the students on the bus must wear a mask on the school bus. So that is outside of our level, that is above us at the CDC orders. And so the main question is really how should we manage when we have cases in the school? So with students who have COVID, who have been diagnosed with COVID, or staff in the school that have COVID, there is no change in our recommendations. Those people with COVID need to isolate at home for 10 days. And that doesn't matter whether they've been vaccinated or not. So if you test positive, you need to stay home. The next level is those people who are exposed to people who are COVID positive. And so we present options here because we know that's what's important to work well in Utah. So the standard protocol and what we did all of last year is to have people after exposure to quarantine at home 10 days, or they have the option to quarantine at home for 7 days and then test out if they're negative and come back to school. So that's our standard protocol that we overall recommend, but we are providing alternatives that local health authorities can do in conjunction with their schools. And with that, I'll present those alternatives. So if someone's exposed at school, we consider someone exposed specifically someone who's shared a classroom, an activity indoors for more than 15 minutes, or an outdoor or an extracurricular activity indoors for more than 15 minutes with a positive individual. The people we don't consider at risk after an exposure are if the two people have been wearing a mask, both the person who's positive and the person exposed. Just like last year's in school, it's the mask on mask. They wouldn't be considered at risk. We know that people who have been previously infected within the last 90 days are protected, so we don't consider people who have been infected in the last 90 days to be at risk after an exposure. And then people who are fully vaccinated, we do not consider them at risk after an exposure. And then just recently we added in this caveat that also if the person who is exposed is wearing a KN95 or an N95, they can be considered not exposed because those masks can filter adequately. And in that case, it wouldn't matter what the person who is positive is wearing. So the local health authorities, as I said, we wanted to give them alternatives that they could choose instead of quarantine. So these additional measures can be chosen sort of on a district by district or region by region level. So the option is that these people who are considered exposed and at risk can stay in schools and do extracurricular activities if they agree to wear a mask for the full 10 days after their exposure, or they agree to wear a mask for the 7 days and they get tested negative on day 7. So this allows people to come back to the classroom with masks on even after they've been exposed to COVID. And I'll point out that's not when they have COVID, only when they've been exposed to COVID. So what is our roles? So educational institutions, you all know your roles, but we want to add on that layered prevention that you were doing last year, but also maintaining classroom rosters so that we can know who is possibly exposed after a case was in the classroom. And then we want to ask the schools to be able to communicate with teachers who also were in that region, and then the families of those children who might have been exposed. And we recognize there's this need to accommodate people with disabilities, so working with them to find a way to use this plan while also accommodating disabilities. And then there is the overall duty that's written in law to communicate, to report individuals who have infectious diseases that are communicable. So the local health department, the next layer, it has the responsibility to respond at the classroom level and investigate and educate. Isolate the cases. We don't have any option about that. We want the cases to be isolated and at home. And then determine exposures. Work with the school to send out letters to parents that outline what choices they have and what approach your area has chosen. And then support testing and vaccination so that we can get more kids vaccinated and out of school if they are actually positive. And then the parents, we recognize that there is a significant part of parental personal responsibility here so that they can make the best choice for them and their children. And so we do have the responsibility as parents that if your child is positive, they need to stay home isolated for the 10 days to not spread the infection. And then parents of children who are not at risk post-exposure, they continue routine precautions and symptom monitoring, but can go to school. And then children who are at risk, so those who aren't vaccinated, who didn't wear mask on mask, those lists I told you before, the parents are either given the option to quarantine them at home for 10 days, have them mask and test out at 7 days, or mask for 10 days. And also they quarantine for 10 days and test out at 7. And then everybody's responsible is to stay home when they feel sick. So going forward, I think everybody's frustrated how often things are changing, but unfortunately this virus changes on us. It's not our choice to have things change. The virus is changing and making us change. So we all should anticipate that there's going to be changing patterns, but also changing in local implementation. So some districts might choose a different way to implement than others. And I think we all can work together to evaluate how different areas have worked and what has worked well for some versus not well for others, and learn from each other and adapt from that. And so I think this is sort of an intermediate plan, because I think all of us hope we will have a vaccine for those younger students soon, and that will totally change how we approach this. But for now, we need to have this protection in place. And so overall, this plan, we felt after discussing with local health authorities, with different schools, with many different stakeholders, was the best approach to minimize the burden on schools, to protect health, to limit the mask use to only when it's necessary, and to give parent choice. So with that, I will take any questions.
Thank you, Dr. Nolan. We do have a couple of questions. Board Member Cannon?
Thank you. I was interested in seeing your data charts, but they would have been much more meaningful to me if they had been disaggregated into children 12 and over and children 12 and under, because, or perhaps children 12 and over who are vaccinated versus children 12 and over who are not vaccinated, and then the younger kids, because I guess I'm really concerned about the younger kids. So I have a question. Do you have input for us about the progress of vaccinating children who are 12 and over? How is that going?
Well, first I'll answer your question. So here's a slight graph of sort of what you were asking for.
Oh,
and
thank
that
you.
I do have it 5 to 10, then 11 to 13, which unfortunately certainly sort of crosses boundaries, but you can see 14 to 18. So we're still having cases in those older kids. It's really across all of them when we're having cases. And as I said, we have 40% of our school-age children have taken one dose. And we are seeing an uptick recently. I think to some degree, it's the Delta variant has made people more nervous, more aware of that there is still a risk. I think a lot of people got like this 3 months ago, it seemed like everything was done and they didn't go get vaccine. But now that we have the Delta variant showing that it's back and it's severe, I think we're getting an uptick because of that. But we're also reaching out to multiple like pediatric providers, getting it in the office so it's really easy for families. So we are seeing more kids getting vaccinated, but we always need more. Yeah.
May I ask a
Go ahead.
follow-up? Also, you mentioned that there's hope for a vaccine for those under 12 sometime soon. Can you put any kind of a closer date on that for us?
I think we all wish we could. So I know that there was originally a statement that it was going to be around September, but I do know about 2 to 3 weeks ago, the FDA looked at the data that was coming in from Pfizer, and they asked them to do add in additional children. And I think they're being very cautious, which we all want them to be cautious, right? We only want to put out good vaccines. So they asked for additional children, which means that's additional time. So I have not heard any official timeline.
Not end of the year or anything?
No, I mean, everybody says they're still hoping that it will be at the end of the year, but I haven't seen that that's supported in any way.
Okay, thank you.
Thank you. Okay, Board Member Earl?
Yes, I had a question on the school bus issue, because last week it was, Utah law superseded, but now it's not guidance. They made it into federal law that you have to wear a mask on a bus. So
That-
kids are going to get on a bus, wear a mask,
Yeah.
or have to wear a mask. The bus driver's going to have to deal with this, and then they're going to get off a bus and not have to wear a mask.
Yeah.
And this is going to work for,
I agree. It's
Yeah,
really complex.
problematic.
Yeah, it's really complex. I admit I am not a lawyer, so I do not know what supersedes what. Certainly, we want to talk more through how that's going to work. I agree. It's very confusing.
Can I ask one other question? Then my other question has to do with, specifically with these numbers here. Is this children that were sick that went in to get tested, or is this children that tested positive for COVID?
This is tested positive for COVID.
Do we weigh out the illness itself? And I guess two components to that. Children that are actually sick that have been tested positive for COVID, and children that have a secondary condition, something, a secondary health issue, right? And I'm not using the right term. Yeah,
Comorbidity.
comorbidity. So, and do we have those numbers weighed out in this too, or do we kind of put it all together?
So for this level analysis, it is anybody who tested positive. But we have done other analysis where we've looked for asymptomatic versus symptomatic. And it's definitely true in children, there's a fair number of kids who are asymptomatic. But there's also actually, I think it's, I want to give you an approximate number because I don't know it off the top of my head, but I think it's about 60% of kids report symptoms that are consistent with COVID that cause them to be at home and, well, other than that they're isolated, but be at home and be ill. The ones who get hospitalized are a little bit more likely to have comorbidities, but these are comorbidities that are very common, such as asthma. I mean, that's a comorbidity that huge portion of our population is. So I don't think we want to say, oh, this is only a problem for the severely ill.
Sure,
It's
I just
not.
wondered if the impact was
We
significantly higher or not.
Yeah, it
so.
is for kids. Asthma is a great example. Asthma, definitely the impact is higher in kids. And I'd had to look what our data is, what the other leading ones are, but we definitely do see kids who have other medical conditions are hit a little harder. But we occasionally get the ones who are totally healthy who go to the hospital, and it's shocking.
Okay, this is a quick one. Are they still asking when you call the health department if you have COVID? I had COVID and they wanted to know if my cat was sick with COVID too. Are they still asking that question, or is that one
I
off?
do not know. I'm
Because I did not know what cat symptoms of COVID were. I asked him about smell, but he didn't respond, so.
Yeah. You put
Okay.
the tuna in front of him and he was
Yeah.
interested.
Yeah.
No, I'm sorry, I don't know that.
Okay,
Board Member Klein?
Yes, I'm curious if you have charts from the previous year showing the hospitalization numbers for that same age range of kids, and if it's different from what we saw this year, or if those kids that are ending up in the hospital are kids that would end up there anyway due to just usual, normal seasonal
Right,
sicknesses.
variations.
Because I know, I've worked as a nurse, and the hospitals are often very full during the winter months with kids that have asthma that also get the secondary flu and
So,
cold infections.
I can't say, I don't think I have that here with me, but I can say what was remarkable last year is we didn't see any other hospitalizations. RSV did
Just
not
COVID.
circulate. Influenza did not circulate. All
That's-
these common.
So it just went away for the year.
Well, it's because we did masking. It's because we did social distancing, and all these respiratory illnesses are passed around in a common way. So once we took out that common path, we tamped down COVID really well. I think if we hadn't done those, we would have had much worse COVID. But at the same time, we were able to get rid of influenza, and we were able to get rid of RSV. All these other respiratory illnesses really were quite well controlled.
And there's no way to know for sure, because from my understanding, the PCR test did not differentiate between flu and COVID.
Oh, no,
It
they
was-
definitely did. Yeah, the tests were very specific. So COVID is a very unique test to the influenza. You definitely know one or the other.
And are they
if you have
are they
both-
testing for both?
Yes, well, it depends on which hospital system you're in. A lot of where drive-ups, they were probably only testing for COVID, but a lot of the hospitals where they admitted people who were severely ill, they were certainly testing them, partially because they wanted to know how many people had COVID, but also how many people had COVID and influenza, because our concern is those two were going to come together and be a super, super
Okay.
severe illness.
So what about the studies that have just recently come out that show that the PCR test was faulty?
I'm not aware of those studies. All the studies I've seen from the scientific literature are suggesting that the PCRs are very accurate.
Okay. I have one more question.
Do you have another question?
Just one more question.
Oh,
Is that
okay.
okay? So the N95 mask that you said that they're recommending, on the 3M warning label for the N95 mask, it says, do not use in atmospheres containing less than 19.5% oxygen. Misuse can cause severe injury or death. 19.5% is any elevation above 2,000 feet, and most of our Wasatch Front is at 5,000 feet or higher.
So, well, one thing is I can say that your doctors are wearing N95s all the time, and
Well,
I
not all day long,
Well,
just
certain ones are.
intermittently.
They're respiratory therapists. But we are also recommending for children that they're wearing KN95s, because I don't know how many of you have ever worn an N95. I have. They are not comfortable. And I don't think we're going to convince our children to wear N95s. KN95s are a different level. They're much more comfortable. And those don't have that kind of concern.
They don't deprive of oxygen
No,
the
they
same
do
way.
not. No.
Board Member Hanson?
Thank you. Appreciate you being here with us, Dr. Nolan, and welcome to Utah. During this crisis, I guess it's an interesting time to be here, but we appreciate
Great to
your
arrive
time.
4 weeks ago, yes.
The data that we saw for last year, that included universal masking in schools. Do we have any projections about what might happen this year without the masking
Yeah.
element in there? I know that's a big part of the strategy last year, and it's not there this year.
Right. I think the best thing I can show you is this one where we're saying we might get up to 4 times as much, but it is really hard. I think the best thing we can do, and we are now watching, is watching what happens in other states. Because there's a number of other states that started school this week, and some of them have mask mandates and some of them don't. And just we're having people screen for all what's happening in those other states, because yeah, models are only so good, right? Models are never right. They're an approximation. They can give us some idea. Reality is right. So that's what we're trying to do, is we're trying to watch what all these other states, what's happening as they open their schools. And I think it's important for us to learn from them and not follow directly in their path if we see bad things. So I know there's been a number of reports already of outbreaks in schools. And so we're keeping track which ones are in schools with masks and which ones are in schools without masks.
Thank you. Can I follow up, Chair?
Yes, thank you.
So vaccine status for kids over 12, how are we going to handle that with privacy concerns, or, who's going to be aware of vaccine status for those kids?
So the way we felt that it was most appropriate is that the parents have the option, right? So if your kid is vaccinated, you can present that information, and then they will be exempt from that, the mask wearing because of the quarantine. So it's up to the parents. If they choose not to present that, then their child can just wear a mask for that 10-day period. So it's really a choice on the parent's part.
And then just one more. I know that the health department still has the authority to make emergency directives if you see something, but then local government can override those even immediately. Do you see any scenarios where, and I don't want you to project too far and look at different things, but do you see any scenarios where the health department would actually do that, make those directives?
I think you know Utah better than I do. I've been here 1 month. But I do think, certainly if we see things going out of control and the health, I think one thing to consider is our healthcare system already is almost at the breaking point. And so if we put kids back in school and we then add to all these cases exponentially, our healthcare systems are not going to be able to treat our sick patients. And that I could imagine that might start the conversation of when do we put in directives. Yeah.
Thank you very much. Appreciate it.
Thank you, Board Member Hanson. Board Member Hymas?
Yeah, I have a question about the staff students exposed. It says shared a classroom, participated in indoor activity for more than 15 minutes, or participated in an extracurricular activity. Last year, if I remember correctly, I think they had a distance on that. It was like 6 feet, then 3 feet, then just wear masks. There's no distance if they're in the same, there's some pretty large classrooms.
Right. So this was actually based on feedback both from our different school board, school representatives and the local health representatives, in that the 6 feet distance was really difficult, and it put a huge burden on schools that they had to decide which kids were next to each other, which were actually exposed. So it was actually a compromise that we felt that it was most appropriate to consider the classroom exposed. And we feel that is without a question appropriate in an elementary school setting, right, where kids are moving a lot and it's very hard to know who's interacting with who. So this was a compromise between the health departments, the school boards, the school superintendents. It's what everybody felt the most comfortable with and felt was the least burdensome.
Follow up.
Yes.
Just so we're not worried about the social distancing inside the classroom. We're just, if it is in there, then we're just saying it's all exposed.
So I'll say it at two different levels. We still want social distancing, right? Because the truth is, it is going to help to have less cases, right? Our goal is to not have kids get COVID. Doing social distancing is going to do that. In terms of identifying and telling people to quarantine, we're proposing to take the whole classroom as a unit and ask them to wear a mask for 10 days.
Thank you.
Thank you. Board Member Lear?
Yeah, I'm asking you to look ahead a little bit, and I don't know if and I'm partly asking if you've had any conversations about what will happen after younger students can receive the vaccine, which I'm hoping could be a couple of months, maybe 2-3 months. Yeah. And then if the vaccination rate of students is only what the vaccination rate of adults is, which is pretty poor in Utah, at what point will we consider that there's an outbreak and those children will be excluded from school like other unvaccinated children are in other diseases when there's an outbreak? Have you started to talk about that?
I'm trying to think. So you're saying
Utah has a law that if children are unvaccinated,
right,
the parents have a right based on their conscience to not have their children vaccinated. But if
right,
there's an outbreak of that disease,
yes,
those children can be excluded.
Right.
And I'm kind of asking if you've started to discuss this and at what will be the outbreak level for COVID that will say unvaccinated children can't come to
should
school.
not come to school, right?
And cannot is.
I have not heard conversations about that. So I think what we would do, though, in general, we're trying to normalize this. We're trying to make it the same as the other diseases we have in our guidance. So my guess would be we would be going towards the same direction as what we do with other diseases. But I admit I don't know. I have not been on conversations about that, or we haven't gotten to that point yet. I think we're trying right now to deal with what we're handed right now.
And I don't want to I don't want to pile on at all, but I do hope that there's some discussion of that
Yeah.
because it will happen suddenly and the opportunity to be vaccinated for younger kids will come about quickly. And if we have a 30% vaccination rate of children, which I fear, then that puts everybody, a lot at risk and when we
Yeah,
could
I
do
think for
something
now, if
about
we
it.
have 30%, we're going to have to kind of continue with this kind of approach in a
At
way.
least, I hope. I mean, we wouldn't do that with polio, we wouldn't do
No.
that with measles, we wouldn't. So I hope I hope there's more of an approach that mirrors other
Yeah.
vaccinations. Thank you. Thank you so much for your work and your service and your honesty with us. Because you get a lot of mixed messages when you're in a policy-making position.
Right.
Thank you.
Thank you, Board Member Lear. Board Member Hart?
Yes, I just need a clarification. So you just indicated that it would be the whole class that you would be quarantining with
well,
a
we'd either-
positive case? Or
Quarantining, or they have the option to.
was that a recent change? What, I had heard 3 feet.
So that is a change. This is the current year plan, correct. Last year's plan was 3 feet, and
I mean, I heard 3
also it
feet
was-
as of Monday. Okay, a different question. Could a local health department decide to change that? Or is that a statewide?
consideration of who's exposed.
Because why I'm asking is that is a significant difference. If you are doing 3 feet, then you're asking your teachers to always have a seating chart.
Right.
Because you're only choosing a select group. If we're talking entire classes at a time, that's a different procedure to share with teachers. So I'm just trying to clarify that I'm trying to reconcile
Yeah.
what was, could that be changed at the
Local level.
local level?
Right, and I'm trying to think, I think we do allow that to be changed. So a local level,
Okay.
yes, they
Okay.
could change that.
Okay.
If it is something where if teachers think they can have and are willing to, I think that's what we really came down to, the willing to say who's a contact, is that it was
Okay.
really hard for the superintendents to say they wanted to do that. So that's why we went away from it.
I see. Okay.
And so it was actually at the request mostly of the schools, that they didn't want to do this
Yeah,
contact
yeah,
tracing again.
I understand.
And so, but I do think if a school was interested in it and the local health authority, I think it is something they could work together. on.
Okay,
Yeah.
thank you.
Board Member Earl?
Yeah, so I'm just going to read from the law and then just ask a question about it. So it says an LEA governing board, the state superintendent, or a school may not require an individual to wear a face mask covering to attend or participate in in-person instruction, LEA-sponsored athletics, or another LEA-sponsored extracurricular activity, or any other place on the campus of the school or school facility after the end of 2021. So my question has to do with extracurricular activities, those that maybe are sponsored at the school or normally would be. How are we working with that? And then also, I don't know if this, maybe Board Member Straight, if he has more information, I don't know if the athletic, what is it? The
Utah High School.
association
Utah High
has come out
School.
with their information yet. And are they working with you to align with the law as well as?
My understanding is, yes, they're aligned with the law that they are not mandating masks.
Okay.
And so my understanding is that for extracurricular activities that I think are school-sponsored, so when you bring up the non-school sponsored on school land, I admit I don't know that, but the law is written for school-sponsored, so I think it covers school-sponsored. I think a lawyer would want to look at that better. But yes, extracurricular activities fall under the same thing as the school activities.
Okay, thank you.
Thank you. Board Member Hutchins?
Yes, I was just wondering if I could ask when the LEAs can anticipate hearing from their local health department about some of the more localized decisions you're letting them make.
I know that some have already started, so I think it's dependent on each region. I know some have already started the conversation, so, yeah.
I'm just going to interject a follow-up on that. Is it the local school that makes that decision or the health department, and do they do it collectively?
What I've heard is most of them are doing it collectively, because they have to work together.
Is there a requirement, though, it's one or the other?
I think we say the local health authority has the choice. Yeah, we say the local health authority has the choice of how they implement.
And then, I'm sorry, back to Board Member Hanson's question then, if the health department does one of these choices, can the local jurisdiction override them?
I do not know the legal side of that, sorry.
Okay, thank you. Board Member Straight?
So I guess I've been listening to all this and I'm wondering, is this just informational for us? And here's what the law is and here's what the rules are, and we put out our guidelines based on what we've been told. I'm not, is there any decision, is there any latitude for policy decisions by USBE, or is this just informational?
At this time, it's informational. We don't have an actionable item here.
Right, and I realize that, but, we're coming right into school and I think it feels like we're supposed to be doing something, but we're not, and we have no power to do so. So for me, it's somewhat frustrating, actually, as the board that's given constitutional authority for education. So I guess I have a statement, not a question.
Thank you, Board Member Straight. I have one more question, and I'm sorry to belabor this, but I have a question. Are we overstepping our bounds in the law that states that you can't require masks for children in any manner that we're going to be requiring them?
No, so we did both have lawyers look at that, and we talked to the legislature about that, and they recognized the goal of that law was to prevent like universal masking at all times. They recognize when there's a risk and there's an exposure, that it is a different situation and that is allowed in those situations. So this is specifically how we wrote it.
Okay. All right. I appreciate you coming and giving us this information, even though some of us are frustrated. Oh, Board Member Hymas, you have one more question. I'm so sorry.
I do have one more question. Sorry, I'm getting questions from people who are listening in, but again, is this a directive or a we highly recommend?
So I
know it's a tough question.
So I believe that we cannot give a directive. So the overall, this is a guide, right? So this is where the school can choose and the local health authority can work together. This is a disease plan. So,
Yeah.
yeah.
And just for the record, when the Department of Health highly recommends something, I listen carefully. All right? I want you to know that. Thank you.
Thank you, Board Member Hymas. Thank you so much for coming today and giving us this information. Oh, sorry. Vice Chair Davis has a question. I'm sorry. Oh, because it says Laura Belknap on here, I thought.
I know. I'll take it as a compliment. I'll take being called Laura. Thanks so much for coming today. I was just looking on the website, which is the coronavirus section of utah.gov, and I originally thought maybe it was not current because it says that the Utah Department of Health strongly recommends the following layered prevention strategies in K-12 schools, which actually are different from. Then as you scroll down, then it gets to the more current types of things that you said you're recommending. So is that because the Utah Department of Health doesn't necessarily agree with this sort of compromise? Or is it, for example, here it says the Utah Department of Health strongly recommends the following layered prevention strategies in K-12 schools, encouraging everyone 12 years and older to get vaccinated and wearing a mask when indoors.
Yes.
Which is different from only wearing a mask if you've had an exposure. So I'm just wondering how that works out information-wise and if that's delineated as to, this would be our ideal, but this was a compromise with school leaders, just so parents at home can kind of see and make their decisions.
I think we wanted to put out for parents, so they have the best information, right? If parents want to know the best way to protect their kid, that's what we wanted to put up in front on our website. So that's what that beginning is. The best information we have, it is the best thing to do is get vaccinated. Second best is to wear a mask. So that's what we put up front is, if you want to protect your kid, this is the best way to do it. And then we go through the ways that the health department can work to protect the children and when there is an exposure. So that's what we're trying to do in the website. Give parents the best information and then give the policymakers and the people who have to do the action what they are requested to do.
Thank you.
Thank you. Now I didn't miss any more lights, so thank you so much. We are going to go back, and Sarah, will you come again and answer questions about the COVID relief plans? Thank you so much, Sarah. I know that some of you had questions, and I think I know that I saw Janet, Randy, Carol, and Board Member Earl. So Board Member Earl, go ahead.
Yeah, so I have a couple questions. There was a question I was asked by a local board member yesterday about using the ARP funds for capital expenses, like the ventilation. Is that a legitimate use?
So yes, thank you, Board Member Earl. In terms of the allowable use cases, Utah accurately reflects all of the allowable use cases, which does include the capital as well as the opportunities for improvement in HVAC. I would add an additional kind of just detail related to that, which is because the expenditure is over $5,000, they do have to pursue a secondary approval specific to that project that's required by the federal government that our state is administering. And those details are available both on the website as well as have been provided to LEA leaders.
Okay, and I knew you had talked to the LEA leaders before, but I think maybe some of that information isn't getting clearly to the local boards. Does that make sense? And then along that same line, if a board, and this has been a little bit of a concern I've had, is that we're hurrying to put these plans into place for a whole bunch of money for the next several years, but their most pressing need may not be known. Does that make sense? And so as they get towards mid-year, they may say, oh, we wanted to change midstream, we have a more pertinent need or a usage. Can they change those plans?
They can, thank you. So they are able to change those plans, and we do recognize and have taken this approach with the previous ESSER awards as well, that, as shared by our expert from the Department of Health, that COVID continues to change and our needs and responses need to change as well. So two mechanisms for that. First is that in the Utah Grants Management System, all of our existing awardees have the opportunity to propose a budget amendment that allows them to make those modifications to all of their existing COVID-19 relief awards to be reviewed by staff to be in alignment with the federal use cases before it's approved. Specific to ARP ESSER, they are able to make those changes. However, they do have to make those changes and have them approved by their local school board before they are submitted to USBE in alignment with those expectations of stakeholder input.
So it's there, just a few steps to take.
Correct.
Right, okay. And then I just have one more question. This has to do with the $12 million for after school, summer school. Do they, and I think I've asked this before, I just want to be clear, especially, I think we're going to have concerns here if we're not careful. Do they adhere to our rules and expectations as a state board, or do they adhere to the expectations of whatever organization is asking for the funding?
So it's a great question, and I see that we have Camille Sheik joining us via Zoom, who is our expert for the 21st Century Grants and one of our agency leaders related to this effort. So Camille, I'm wondering if you heard the question and are able to provide an answer.
Yes, hi Sarah. Yes, Camille Sheik with the Utah State Board of Education Specialist. May I ask a follow-up question, Board Member Earl, just so I understand the question? Is it with community-based organizations?
I don't know who's applying for this money, so I don't know. Yes, I guess the answer would be yes. The money's coming from us, right? So I'm asking if they have to adhere when we go through the certification, or I don't know, what are we doing?
Review process.
Yeah, the review process, especially where we've highlighted 4 areas, making sure parents are aware of the content, age appropriate, right? I mean, those kind of things. Things have been vetted thoroughly. That type of a thing is what I'm asking. Because the money's coming from us, will they have to adhere to those kind of things?
Absolutely. They will go through a thorough review process with a group of qualified grant reviewers. After we have those who are recommended to be awarded, I will review them. I will follow up with any questions. I also work closely with Sarah Young and Sarah Harward and Jessica Carr, who are part of the CARES team. So yes, they will follow all the USBE policies and procedures for the after school and summer programs.
Okay, thank you.
The money goes to the LEA though, correct?
So it's actually something where the partnership, it requires both a community-based organization, business, and an LEA. However, they can decide who's the fiscal agent related to that as part of their application.
Thank you. Okay, Board Member Booth?
I wanted to just comment, as we've observed the last few months, the complexity of this awarding process, resources that have never been known to man in the past, in terms of the numbers of resources, the numbers of opportunities. Of course, we're in a very unique situation with COVID. But I just wanted to compliment Sarah and this very extensive team who, though I think sometimes you don't feel like it's extensive enough when you have to meet the deadline and get everything in and all the approvals and the public input and the input from superintendents and boards across the state. It is unbelievable to me that you are communicating as clearly and managing this number of resources and this many number of requests with as much clarity and with answers to all of these questions. And I know this is just the tip of the iceberg in terms of the questions that are coming to you across the state. So I'm just so grateful that in a highly unusual set of circumstances and more than ever before, resources that need to be carefully monitored, and we need to be accountable for them, and we need to understand that accountability both from a state standpoint, from a federal standpoint. I'm just so grateful that you have an organization and that you're managing that organization in such a responsible way. And I want to say thank you, because it takes a huge burden off of us who are policymakers, who are concerned about the big picture, just to know that you're taking care of business. Thank you very much, Sarah.
Thank you.
Thank you, Board Member Booth. Board Member Lear?
Thanks. I have a specific question that was just raised, and then I have two more general questions, if that's okay. You just mentioned HVAC systems, and I know that there was an interesting provision in the state that was passed by the state last year that didn't allow LEAs to use, was it just state money or also federal money for HVAC systems? And if somehow that's now changed, I know there are a couple of LEAs that would love to improve some HVAC systems with this money. Is it they can or they cannot?
Yeah, so I appreciate the opportunity to clarify. So this really, the best way to answer it is in the fact that we've received multiple awards. So the reference that you're making to the state legislature in regards to when they appropriated our second set of ESSER funds, so ESSER 2, do have some of those state criteria related to if an LEA chose to spend their ESSER 2 money in an HVAC or capital expenditure setting, that the state would be reducing their MSP allocation dollar for dollar. So it does not prevent them from using their funds that way, which is ultimately in alignment with the federal requirements. However, it does create what we call a reverse match in terms of it is a negative fiscal incentive to the local dollars. That is only specific to the ESSER 2 awards. So as we move forward with ARP ESSER or ESSER 3, the state, when they appropriated this money to the agency to make these local awards, did not provide that guidance. So we are able to exercise the full suite of federal allowable use cases, including HVAC and capital expenditures.
Thank you. So ESSER 3 is kind of got to be what I communicate. Thank you. Then my more general questions, very general compared to what you presented, are one, can these awards go to like, and I forget, I can't say the exact name of what their regional service centers are now. Could they go to a regional service center for use for its members if small districts don't have the capacity to apply?
It's a great question. So the way that the funds themselves, specifically for ESSER, are structured, it does require us to award the 90% using the Title 1A allocations from 2019 direct to those LEAs. Okay. I will say that we have definitely worked with all 4 regional service centers in terms of making sure that they have the appropriate information regarding these plans to be able to support their local school districts and charter schools they serve. And as a component of that, we are supportive of some of those smaller districts sharing those plans and opportunities before they're submitted to the state board, just to help reduce kind of the overall workload and burden.
Great. And then I always, when I look at those charts that flash by quickly, it always is concerning to me that only 60% of them are used or 38% of them are used. And I know you pointed out that some of these are newer so that they haven't been encumbered yet. But I'm just more asking a general question. Do you find that we leave a lot of this money on the table, or do you find that in the end, it's all spoken for by LEAs?
No, it's a great question. So I will say my sense in terms of working with our LEAs is that in most cases, these expenditures are either have already occurred or they are planned for and encumbered in terms of future activities down to the dollar. Okay. And the reflection that you see on the screen is usually limited to local business administrative capacity. So in the same way that they are needing to submit full documentation related to these particular funding streams, they're also doing that for all of their traditional programs that they use for schools, both from state and other federal funds. So oftentimes there's a bit of a lag, and that lag is not reflective of the activities and the needs, but instead really just having the manpower necessary to submit all of the paperwork that's required.
Your last, just one short.
Just one more.
I promise, just one more. Well, everyone else is doing relay questions, so I thought it was okay. I'd get away with it too. Do you find that the paperwork is excessively cumbersome, or do you feel like based on the money they're getting, it's pretty fair? Or is there anything we can do about that?
So I think that, I mean, so you're asking a question of the individual who helped establish those guidelines. So I would reflect they're accurate and fair. However, I will just note that I think one of the key components for us as an agency was noting that these funds were being delivered very, very quickly to address needs that needed to be addressed immediately. We didn't have a lot of time to say, like, well, let's write, a lengthy plan and, go through a lot of some of those components. So noting that the awards were made quickly, we are requiring that they document how that money is spent for reimbursement purposes for our monitoring in alignment with the federal requirements. And that is necessary because we do have the opportunity then to work directly with our LEAs as they may may submit expenses that are not allowable, and instead be able to then shift those to appropriate use cases and needs so that we prevent the, ultimate kind of conversations related to the monitoring, auditing, both at the internal level, the state level, and the federal level.
Thank you. I hope it's as minimal as possible, because I feel like this is money that's way overdue for so many things. Thank you. Thanks for indulging.
Thank you, Board Member Lear. Board Member Norton?
I really hate to work in the hypothetical, but we're going to have to go to the hypothetical for this. Just for clarity purposes, can you give some examples or ideas of what was actually meant when you talk about the partnerships and local businesses interacting with this? Can you maybe, give me some structure on that?
Of course. And so I'll give a quick overview, and then if there's additional questions, we can also direct them to Camille, who's with us. So in terms of the general overview, the focus of these particular funds, as required by the award to the State Board of Education, is that we are supporting after-school and summer learning opportunities that are evidence-based, and that is through a partnership work, mainly because I think it's important to realize most of our LEAs feel like capacity is definitely stretched, if not already at a breaking point. And so by having those opportunities to say, if we are offering additional services that may be available to sign up for families and individual children, how do we do that in a way that is not taking on the burden exclusively to teachers and principals and schools, but instead really working together with those community partners. So Camille is with us. If you're amenable, I'm sure she can share an example just to kind of highlight what that looks like.
Would you like an example? Yes, please. Camille?
Yes. Thanks, Camille Sheik, USBE. So one example might be if you're in a smaller rural community, working with a local business to bring in volunteers to help, obviously having them receive training and background checks as applicable, but help having maybe a local volunteer pool if it's a rather small rural community. And again, that was feedback as we were looking through the initial draft application from some of the public, that it might be hard for our rural communities to have like a community-based organization such as a Boys and Girls Club or a YMCA to help, as Sarah said, to support the schools and the school staff with providing those evidence-based services.
Is that good? Board Member Norton?
Thank you.
Okay, thank you. Board Member Moss?
Quick clarifying question about the kind of flexibility and modifications as we go forward. So the stuff that's, the 12 million is fairly narrow, at least comparatively. You've got after school and summer learning stuff. The broader amounts that have, the grant requests have gone out with the September 17 deadline, that's for the rest, right? How much specificity or flexibility, well, put those in order, how much specificity do you need up front to allow flexibility later on? If you learn something during this next year, for example, and you say, well, I think something else looks like it worked better over here, or we found this here, do you have to match that up, tag it to something that was in the same general vicinity of the new program you want to try? Just how binding is that September 17th initial application? Does that make sense? Because we're going to be learning a lot, right? As all these districts, LEAs, charters do things, we're going to know a heck of a lot next year. So I'm just curious how much real flexibility is in there to guide their initial application, right?
Yeah, so there are a lot of flexibilities in terms of the process moving forward. So there, aside from the commitment to the assurances that have been listed in alignment with the federal legislation in terms of providing reporting and records related to these efforts and being in alignment with those 19 use cases, I'll give just a potential exemplar. So if we have a an LEA that submits and is really thinking that the majority of their funding needs to be specific to serving students in high school with credit recovery. 6 months in, they realize that it's like actually our need and our root cause is not specific to just the credit recovery, but we also need opportunities to improve our student information system so that parents have that information sooner rather than later. Both of those, in response to COVID, are allowable use cases, and an LEA, provided that they get approval from their local school board, has the opportunity to be able to say, no longer spending all of our money on these credit recovery opportunities, instead, some of our money, and then the rest going to the other eligible use case of building out a more comprehensive SIS system.
Great, okay. So as long as you're working within those 19 permissible use cases, you don't have to pick your horse and then slight modification. You can say, this is working better and, okay, thank you.
Correct.
That's great.
Thank you, Board Member Moss. Thank you, Sarah, so much. Okay, we will go on to 6.2.1, the Scribble contract renewal. Naomi, are you presenting, you and Rick? Jennifer is not on my list, so.
I was instructed to be here.
Oh, okay. So if you'll each introduce yourself, and then we'll have the discussion on this contract. Thank you.
You guys introduce while I get set up. Go for it. So I'll have them introduce themselves while I get the internet to connect. Sure. I am Naomi Watkins, the Secondary English Language Arts and Library and Media Specialist.
I'm Rick Gaseford. I am the Education Technology Specialist in the Digital Teaching and Learning section.
There.
Yes, you are.
Having learned, I have to get real close. Jennifer Thoronson, Director of Teaching and Learning. And we are here today to present to you an SR2 proposal. We know we are out of sequence, out of timeline, and so we apologize for that, but there is some urgency to not disrupt service, or if we are going to disrupt service, to allow teachers to know as soon as possible. So this was a SR1 proposal that we brought to you initially and was awarded by the board to provide Scribble statewide to our teachers and students in grades K through 12. Last year, that contract is expiring, and so the opportunity ahead of us is to decide whether to extend that contract, which is why we're here with you today, or to go ahead and leave that contract closing and let our teachers know that this tool will not be available to them this coming year. So with that said, we're going to kind of set the stage as to why Scribble and move into what it is, and then have a testimonial from Chris Sweeney in Carbon School District to share how his team is looking forward to using this tool this coming year. The field had, mixed messaging on, oh, we have this tool forever. Oh, no, the tool is going away, potentially. And so he'll be able to express how his school is planning to use it in his district across contents, across kind of a collaborative environment. So with that said, I will kick off the presentation and then hand things over to Naomi to share the teacher perspective. So if you've seen our preliminary RISE and ASPIRE data, we have less than 50% of students in grades 3 through 11 that are proficient in reading and writing. With that kind of story, we wanted to say, well, what are the things we can do to kind of help compel advancements and acceleration in student learning? One of the allowable uses of ESSER2 funds is digital tools that allow for interactivity and engagement with students between the teacher and students that is in real time, active, provides feedback, and this tool has really found to be extremely useful for that. So as we look at that 47% or less of students are proficient in English language arts, depending on the grade level, we have a need of students that need to advance their reading and writing skills. The second one was the data point we collected from teachers. 66% of students cannot distinguish between fact and opinion. That is astonishing to me and hopefully to you as well. We have this ability to use a tool like Scribble to help to encourage that development of that skill set of being able to determine fact versus opinion, which is a very important skill, as I think all of you are aware, for our students to develop in the K-12 system. The last one is the tool itself allows for research skills to be built. It helps to bring all of their materials together, to keep track, to help with citations, to really afford this seamless opportunity. Any of you that have had a classroom of teachers or students or been researchers yourself, finding all of your sources, being able to cite them appropriately, taking notes on them, ends up being in a lot of different houses, whether it's Word or this file, or I print out materials. This puts everything in one place and really takes the cognitive demand to the learning rather than the organizational skills of where did I put that file? I found it last week in class and now my teacher wants me to pull it up. Where is it? It really helps to reduce some of those things. So the research element is really strong in the program. In terms of how this tool aligns with what we are promoting as a state in our Utah's K-12 literacy framework, there are specific things that it really attends to extremely well. The first one is the ability to tailor instruction. There's this interactivity within the tool that allows teachers to give feedback in real time. It allows students to collaborate across the system as well. They can be reading the same article. They can be putting in their thoughts and notes. Their colleagues or peers can see them. And the teacher can also see them and be giving feedback along the way and asking additional questions. So it creates a really engaged environment because you're able to see that feedback coming in real time, whether you're live and in person or at a home-based model. It's evidence-based, so we've seen some great results in terms of the quantity of our students using it. We only had it in place for about 6 to 8 months of the school year, so it's been a short amount of time. But in terms of the pieces that it brings, it does align with our standards. It allows for teachers to really leverage this tool to meet learning needs. It provides that targeted feedback. Feedback has a very high effect size in our classrooms. It has 2 years of growth in one when you get feedback from a teacher in a timely, sensitive manner that's specific. And this tool allows for that. They can monitor student progress. They can look at the resources they pulled in. They can give feedback along the way. They can set standards of expectations and monitor those standards. And again, provide students with feedback. The final one there that aligns with our framework is really allows students to be engaged and allows them to monitor and assess their own learning. So the metrics the teacher can see, the student can also see. So it's not the teacher's grade book, can't see into that, but they can also see like what have they collected in respect to the expectations that their teacher has set. So it allows for that self-assessment component to go along with the system, which is another very effective evidence-based practice. So in terms of the work in progress and how this tool aligns with some of the work that we're currently doing is in our implementing our strategic plan, we have that promoting high quality instruction in early grade classrooms. We really need, looking at our data, we need to promote high quality instruction in every grade classroom, and this will help to allow for that engaged and feedback-rich environment. The last part, as our team has started to work on, is a literacy achievement plan. So looking at our data, where are we as a state in our K through 12 system, well, pre-K through 12 system, from the data points, where are our needs, and starting to identify those strategies that will help us to achieve those. Given the research base around reading and writing, these are the things from the research literature that are expressed to show great gains in student achievement. So as you kind of read through that list, I won't read them to you, but those are the typical strategies that have been found through the research to be highly effective in changing student outcomes. And when we look at the Scribble tool, it does the top 4. So it doesn't do sentence combining, that could be taught by the teacher, but the other pieces are afforded through the system to allow students to have those opportunities to get peer assistance with their goals because their peers can look in and share their ideas and give feedback. It helps students to have those opportunities to summarize. We're pulling in information and we're having context to provide those summarizations in the system. Additionally, within our evidence-based reading practices, the nice thing about reading and writing is they complement each other. When you improve one, the other one is impacted as well. So as we look at the evidence-based practices for reading and compare that to what Scribble provides, you're going to hit all but one of these. Specifically, strategic tutoring is the one that it doesn't hit, as that requires some more explicit peer interaction than what Scribble would typically afford a teacher to engage with. So within the evidence base, Scribble has a really strong correlation and relationship to what we would expect high quality instruction and leveraging digital tools within our high quality instruction to improve engagement and our opportunities to provide timely feedback. Just to kind of give you context for what do we already have available, what tools do teachers have in various grade levels. This table is meant to represent the different grade spans. So on the kind of left side, you'll see K3 tools, in the middle grades 4 through 8, and then 9 through 12 on the far side. So I'll just let you take a look at those. And the number of students using those software or those digital tools is also listed, just to kind of give you an example. Our early reading software we've had for about a decade now, and is up to 153,000 students. So with time, we see an investment in money. I think we started in that program with $3 million. It is up to 11 million now because of such great usage by our school districts and charters. Then we move into Utah Compose, which is our writing tool for kind of giving students feedback on the quality of their writing. Then you've got our Acadience reading assessment, which is really for teachers and students to understand where they are from a universal screening standpoint. This past year, legislation passed it involved grades 4 through 6. So those numbers aren't accounted for in that quantity because that has not started yet. Scribble is down there in the 6 months, and that's what this kind of time frame of usage is monitoring. These are the number of teachers that started. This was COVID. We started the program in October, so it was not there for the teachers to start the school year with. It was during the year of COVID. The fact that we had as much usage as we did is actually pretty impressive. We had a tool prior to Scribble that had some similarities, but definitely not the the depth, and the interactivity with Canvas and different tools and Google that this tool has. We have more usage in Scribble in 6 months than we saw with the old program in a decade. So that is just something to kind of keep in mind. Teachers saw great value and really started to use that product in a year that it was really hard to take on anything new. We would expect one of the hesitations for teachers last year as well, beyond the COVID impact, was it was a one-year contract. Not a lot of teachers want to invest their time in something that's going to go away in a year. So that's something that for us to consider. We have a plan for how we would fund this long-term when ESSER funds are no longer available that we'll talk to you about as well. The last one is just our RISE benchmarks and interim assessments. So you'll see out of this, you really have 3 assessment tools and 1 early reading software, which is more instructional, but there really isn't a tool that's instructional for our intermediate and upper grades. So one of the reasons that we are here, not in November, where you were expecting us to come and do ESSER proposals, is the timing of the contract. So the contract is expiring, and we wanted to not disrupt service for teachers that have become users of the program and want to use it this coming year. And if that is the case, if the board decides we don't want to promote this digital tool, we just want to be able to let teachers know so that they can adjust their plans accordingly. So with that said, there's a few pieces for this piece. One is our student outcome data. When we look at having less than 50% of students in grades 3 through 11 not proficient in reading and writing, we have some urgent work to do, especially as you look at secondary students. Less than half of them are ready to really graduate with the types of reading and writing skills we would want. And this tool helps to really empower teachers and students to advance their reading and writing skills. It has an annotation feature where kids can really dig in, leave their thoughts, ask questions, and really get into text rather than just consuming, but really interacting with the text. The second one is the board approved this request previously. So in ESSER 1 funds, this was approved by the board. Some of you were not on the board at that time, so we just wanted to make you aware. This was previously approved. It was a 1-year contract. ESSER 1 funds were a 1-year funding source. So that was the kind of the contract that we put into place. The other piece that I wanted to hit is the consistent use. So when we started a product in October, teachers like to build routines. It's really nice to have a product at the beginning of the school year to build routines so that your students get familiar with the tool, they know what the expectations are, and it just becomes part of the work. When we have disruption of service, if we were to delay until December, you'd have not that consistency, and now we have to throw something in later where teachers could have kind of embedded this into their practice earlier and are more likely to have consistent practice with the tool. So with that said, we're going to transfer over to the teacher aspect so you can kind of see what the tool does, as well as hear from a local educator of how he's been using the tool and how him and his colleagues will be using that tool. And I'll hand things over to Naomi.
Thanks. Well, I'll just lean closer. Thank you. So if you're like me, I'm a very visual learner, and talking about a software is not a way for me to actually understand what the software does. And so we have 2 educators, one who is we recorded him talking about the software and showing it to you and what he does with it. And then we will have Chris Sweeney from Carbon Schools joining us by Zoom to talk about his plans. But I do want to hit how Scribble meets some of these student needs once again, because we reached out to teachers who were using Scribble and asked them, like, do you like it? do you not like it? What do you like about it? And there was an overwhelming positive response by those who used the tool. And the things that they really hit on, and Jennifer touched on these a little bit, were the ability for students and teachers to create their own libraries. I know personally when I have gone to a website and found this really great article and then go back to it later and the link's expired, there's nothing more frustrating than that, and that happens all the time. And kids using Scribble are able to then store these articles and different resources into Scribble, and they don't disappear. Teachers then are also able to create their own libraries and share them with students. And you'll see Trent talk about this. They can really critically read and annotate sources, do it with themselves, with a teacher, with their peers, and that can also happen if they're in the classroom or if they're at home. So that would help with that hybrid learning that may or may not be happening. And the other thing, they can do it all in one program. As a middle school teacher, there was nothing more frustrating than waiting for kids to find the things that they needed to do to write their paper or to work on their thing in the classroom. It frees up that space to really work on ideas and really composing and really crafting arguments and research in the classroom and with other students. So the last one, of course, is seeing a real-time progress, knowing how students are progressing. Are they using credible sources? Are they not? So we're going to go watch this short little video from Trent Mikesell, who is at Nebo School District. Yes?
Naomi, before you do that, will you please introduce yourself?
Oh, I'm
Because
sorry.
you didn't. Thank you.
A little music from my introduction. Naomi Watkins, Secondary English Language Arts and Library Media Specialist. Sorry about that. Okay, so here is Trent Mikesell.
My name is Trent Mikesell. I am a teacher at Nebo School District. I'm also an ELA specialist for my school district, along with teaching. Personally, as a teacher, I've used it in a couple of different ways. So one is just the basic kind of annotation tool, where I have students read through and I give them a task to just share their thoughts about what they're reading. So you can see over on the right here, this student has shared her thoughts. It's nice that you can reply to students, and I think we're going to show that a little later. For this particular assignment, I actually called her up, and what I like about Scribble is she's shared this with me into my library. So when I call the student up, I can just pull up her article and we can talk through her comments and the things she thought and just have a conversation, and it's right there. It's easy for me to pull up. So that's probably one of the more basic uses that I've used it for. A little bit more of a complex assignment that we did is I had students highlight in different colors to mean different things. So for example, things related to the claim, they highlighted in red. Things that were, that gave context for the article or gave information about just kind of what was happening in the article, they highlighted in blue. I think this person is sort of a, almost purple, but that's their blue. And then yellow was evidence, so evidence that supports the claim. And then green and pink had to do with counterclaims and evidence for the other side and things that contradicted the main claim. So one of the things that's been useful for Scribble too is it allows me to check student sources. One of the things we're always focusing on is just making sure students are using credible sources, that they're using, you know, sources from good places that are going to be reputable, that are going to give them factual information. And this allows me to kind of make sure that that's happening. So I can click on these articles and just kind of look at where they're coming from. And I can see, you know, their sources, if they're using reputable things, or, you know, if it's even on topic. Like, for example, this looks like a book review of some kind, which wouldn't really be what I wanted them to do for this assignment. And so even though the information in this might be factually accurate, I don't want them to use book reviews for this assignment. So I can also look and say, you know, it kind of gives me the ability to help them understand how peer-reviewed journals work, and that there are going to be editorials and things that don't necessarily work for what they're doing for different assignments. So in Scribble, you can create different assignments for students, and then you can see their progress. So right up here, it kind of gives you an overview of students who are on target. And this was a practice thing. So in the end, it didn't really matter if they were on or off target because I was just having them practice using Scribble for the first time. But it shows me the sources in their library, if they've met the word count, for their annotations. So you can set a word count and say, I want you to get at least 500 words of annotations. You can see if they've met that. And then you can click on their name and it will take you to their library. And you can see their sources. You can even go in and see their annotations. But it kind of gives you a quick overview of, oh, this student hasn't done much yet. I wonder what's going on with them. Or these students are all on task. They're doing what they're supposed to be doing. So one of the things that's nice is that you can have a live exchange with the student, whether they're in class or remotely. So we have a student on right now who has made a few comments for us on this article about anxiety. And I know that she's on, and so I'm going to be able to have a conversation with her about what she's reading. So I'm going to say, and now she can respond to my question and we can have a little bit of a back and forth dialogue. So as she's typing her comment back to me, one of the things that's nice about this, and I've used other programs as well, largely I've used Google Docs to have this kind of back and forth conversation, which that has, you know, its own benefits and negatives. But what's nice about having it in here first is that I can use articles that we couldn't access in any other way, that we couldn't have this kind of conversation on. And it's just a little bit more fluid in terms of making comments and getting immediate responses. What I really like about it is just this ability to edit PDFs back and forth, to have conversations in real time and, you know, make it very easy to do that. Or this student is reading an article, and so I could go down here and I can make a comment to her and say, I want you to pay close attention to this part. What do the percentages here mean to you? And so now she can respond to me and answer some of my questions. And what's really nice about this is, of course, this is just one student, but you can actually share your library with an entire class. So I could go through an article and highlight some things I wanted students to pay attention to and ask them some questions, and then they can make a copy of that into their own Scribble library, and they can have a back and forth dialogue with me. Or you could put students into small groups and say, I want you to have a conversation about the things I've highlighted, or highlight your own things and have a conversation. There's a lot of different ways you can make this work.
Yeah, just to wake you up a little bit with that little jazzy tune. Thanks, Jerry. And now we also have Chris Sweeney from Carbon County School District. I believe Chris is there on Zoom.
I am here. Hello from sunny, very warm Price, Utah. Can you all hear me okay?
Yes.
Perfect. Perfect. Our high school library media specialist declared, oh, by the way, I'm sorry. I am Chris Sweeney. I'm the social studies specialist here in Carbon School District, as well as teach social studies at Carbon High School. Our high school library media specialist declared, of all the tools and software I'm aware of, if I could only get to choose one, it would totally be Scribble. We have used this software to assist students in collecting sources, keeping track of highlights and notes, creating a works cited or bibliography page, and writing papers. It is an extremely easy to use software for both advanced students, where it saves them precious time, as well as struggling learners who are able to keep everything in one place so it doesn't get confusing or lost. We have been able to track and more easily help students find and vet credible, reliable sources as evidence for their schoolwork, and also assist in avoiding plagiarism. Teachers can see where students are in the process and tailor learning and feedback to their specific needs. Our students, have Chromebooks, and we use Google Suite in our school district. Scribble interfaces with Google so that the students can write their work right in the application. Scribble is not just a tool for students. Our teachers can also do professional development and collect resources for lessons and activities using Scribble. One teacher used Scribble to collect readings for her classes. She could upload PDFs and annotate them, like you just saw in the example in that video, for students to study. Another teacher used it to write academic papers while she was working on her master's degree and other professional development for her degree. A third teacher collected websites he wanted to use to teach fact-checking and informational literacy to students. Teachers can use Scribble for short lessons. They can also use it for bigger and more long-term projects. The teacher becomes a collaborator in the reading, research, and learning rather than the final product evaluator. Scribble is new to us last year, or was new to us last year, but easy to learn and to experiment with even during our COVID pandemic. Now with previous exposure, we can rely on this software in the classroom this year. A 10th grade student told me, "Thank you so much for sharing Scribble with my teacher. This student loved to do personal research and was using Scribble to pursue his own personal success as well as his schoolwork. We have routinely been able to get learners up and running in Scribble within about 15 minutes. They're then on their way to creating intellectually honest work. When we initially presented the Scribble tool to students and showed them how it works, kids were audibly excited. I kept saying, but wait, there's more. And I'd show them another thing in Scribble that they could do that they got excited about and would definitely save them the precious time that they needed. We in Carbon County School District have grown to love Scribble in the very short time we've been able to use it. It's replaced other softwares that we had been using and keeps it as a one-stop shop for all things research, writing, reading, studying, analyzing. We just love it, love it, love it. And we definitely recommend to continue this contract because we already have lesson plans ready to go for this school year and really just love Scribble. And thank you so much for your time.
Thank you, Chris. And that concludes our presentation.
Thank you so much. We have several questions, and if we could leave them to questions since we are quite far behind in time. So Board Member Lear.
I wonder if you have a chart of how many LEAs use Scribble.
I do have this data. One moment. You might even know.
It was 95 LEAs.
Oh, that's Matt, go for it.
We actually had the company provide that data for us. 95 of the LEAs have reported use in the last 6 months.
Out of 140.
Out of about 140, yeah.
That's good enough. Thank you.
Yeah.
Thank you, and I hope you do everything you can to spread the word, because I hate having state resources like this that are free to them and they don't know about it or use it. Thank you.
And that is the plan, to do exactly that, to share this
Thank you.
information through multiple resources that we all have across the way that everyone will know.
Thank you.
And they do know.
Thank you, Board Member Lear. Board Member Hutchins. Oh, Board Member Cannon, sorry, Stacy.
Thank you. Just a couple of quick questions. So the money that you're seeking would come from ESSER 2? Is that, it was first done through ESSER 1, now this would be ESSER 2. And it's one-time money, but you're asking to enough money to use it for 2 more years?
That's correct. So it would be ESSER 2 this time. It was ESSER 1 the first time for 1 year. We're asking for ESSER 2 for 2 years. And then the long-term plan would be to work with UEN. We've met with Laura Hunter on this product, see how this next couple of years go, bring that data to the legislature, and UEN has their own dedicated funding pool that they could make the official request to continue the contract beyond that, so that we don't have to keep kind of piecemealing this. It would be a long-term. But this allows us to try it out, get that buy-in, see how it's working, and bring it to the legislature.
And so then LEAs access it through UEN, is that correct?
We've set up a contract that allows we gave domains. Rick can speak better to this. I'm gonna hand it over.
Actually, we just have them contact the company. They're already set up. They've already got, by their domain, which is their, we have schools.utah.gov, whatever that domain is. They've already been set up in the program. We just have to, they just have to contact and say they want to be able to set up this many accounts.
Okay,
And they can bring those accounts in via their database, and because we've already set it up so that they can just take all of that information, all the student information from their SIS system, push that into the system, it automatically creates the accounts.
Well, there's a devious reason that I'm asking that question, because I when I saw this come up, I went ahead and watched some videos on Scribble, and I thought, I want Scribble. Scribble looks like it would be so fabulous. So, if when you're doing that, you want to open accounts for state board members, I'd be happy to take one.
Probably could find ways to make sure that occurs, and I might add that, I've been doing education technology actively for 33 years now. I've seen a lot of things come along the way, but this program has 2 things that I think are really important. One, it supports learning first. It's not about the technology. And 2, it makes kids think analyze, and bring their knowledge and their work to a blank screen to create. And that's the most powerful learning that we can have.
Thank you.
And feedback loops.
Thank you, Board Member Cannon. Board Member Hutchins.
Yes, just a quick question about the functionality of Scribble and its alignment possibly with Utah Compose. Do they overlap? Would a school use both? Or
We've
choose
thought
one or
about
the
this.
other?
They're complementary, so you could take what the student has produced in Scribble in terms of their actual like research paper and writing, and then copy and paste that into Utah Compose to score it, right? So the kind of the scoring mechanism is there, but it would require a copy paste from one to the other.
Is that it? Board Member Hutchins, you're good. Board Member Hanson?
Just a couple of quick questions. Are we using this at USB? I mean, do we have people here that are using this for any of our projects?
It was one beyond the LEAs, the 95 school districts and charters. It does say USB-E, Southwest Educational Development Center, so one of our regional service centers, and the Utah Indian Tribe Education Department is also using it, or the Ute Indian Tribe, sorry, let me correct that. So we do have staff using it here. Naomi and I are both doctoral. We've completed our doctorates, and if I had had this tool, we've talked about this, we would have been a much more effective doctoral program student because it just keeps everything there and helps you with your citing your sources. So there is benefit to staff as well.
And then just a quick follow-up on that. Alternatives to Scribble? I don't know, I assume before we let the original contract, we did some kind of a down select to get to that point. What are the alternatives that have this kind of functionality?
Sure. So for alternatives, we actually have had Noodle Tools for years, which is a research tool that many of our librarians kind of adapted. And then they saw Scribble and said, yeah, we're good. Scribble does more than what Noodle Tools can do because of the functionality of being able to bring in the actual library instead of just this where you collect and do your research. This one actually allows you to put all your stored research articles in there. So you find a link one day, it's archived in the system where that link gets broken, you still have the article, which is really nice feature. That Noodle Tools relies on just more of the completion of the work in the system, where this is the complete, it's kind of like going from a 1976 Volkswagen Bug to like the Cadillac, right? Like,
Oh, stop. I love
because
bugs.
it puts it all in one place. It interfaces with our Canvas contract, so it can be embedded in that really easily. They've also worked to do Clever, which is what a lot of our school districts do, so kids have a one-way sign-in, so they don't have to have different usernames and passwords for all the different tools. So they've done that for us last year. It has some great accessibility for our special ed students who might need screen reading and some of those tools available in it as well.
It also interfaces with both Microsoft Office Suite and with the Google Suite for Education. And
Continue,
Canvas.
just briefly, I'm sorry.
All of those already built into the program.
So compared to something like Microsoft's OneNote, which I'm more familiar with, I guess, because that's the software I have, this would be the interactivity between the teacher and the student. Is that the added feature? Because OneNote will do a lot of the things that you're talking about as far as storing.
Yes, OneNote would do a lot of those kinds of things, but I think as Board Member Hart pointed out just a minute ago, it creates feedback loops that you're not able to do as easily in those other programs. And it's really everything in one place.
And then final question on the terms of the contract. Right now, we have a Utah State contract, is that right? So unlimited number of users or something like that?
Correct.
For a given cost. So the more we get the word out, the lower the cost per head is. Because I calculated now we're probably $60, $70 a head, which is pretty expensive.
Yep. So what we would anticipate, like I told you, Noodle Tools we've had for a decade. We actually had less usage with Noodle Tools for the last decade than we have with this program in 6 months of kind of being out there. So we'll continue to ramp up our awareness campaign with it not being COVID, with it starting at the beginning of the school year. We have so many more advantages to us this year than last year that I would expect we'll see much better usage. And all of the programs you see on this slide, we've had for 5 or more years. And so the usage increases as people become aware. Our awareness campaign, we went pretty hard last year trying, but COVID was kind of a barrier. So I would anticipate the word's getting out that we will see increased usage even in the second year that we didn't see in year one, just due to the conflicts.
And do we have any leverage at renewal time to maybe make this more palatable as we look for a long-term renewal? Is there a chance to lower our costs with Scribble? Or?
So we asked them for what the price would be. What the piece that we've needed to add is the professional learning. So teachers can see how they can use the tool, learn from other teachers on those pieces. And so the product, we actually have a pretty good rate. If the school district was going to buy it, it's $5 per student. At the state level, it's $1, and then we pay some additional, I think it's 75 cents for the professional learning. And they've been phenomenal with training our regional service centers, because those folks are boots on the ground and can really get the information out. So we're trying to find different partners. So not only are we trying to, professionally learn or professionally develop each teacher, but we're developing capacity in the state to do that work as well. So I think as we build that internal capacity, we'll actually be able to reduce the price, because we won't need the professional learning offered by the provider in the coming years.
Thank you.
Thank you, Board Member Hanson. Board Member Earl?
Yeah, I have a couple questions. You have a library on there. Is that the educator's library, the student's library, or there are other database libraries located in this system?
So the libraries that are built by the student and the teacher. There's no actual database library from the program itself. It's teachers finding. They might have articles that they have from previous years. They might scan in a chapter of a book, those kinds of things, and put it into the library. So it's teacher and student collections, not a database.
Okay, so
within
they're
the
not
system.
housing a library that the students are going to. So they would probably be accessing most of their information from Google or whatever the teacher puts on it.
Absolutely.
Is that accurate? And of course, I'm going to ask the data question. And I know I just reviewed the policy, but it looks like our standard policy. Are there any concerns with a collection of data, student data, beyond the usage of this content? In other words, is this an indefinite storage of student data? How does that work? Which may be good or bad, right?
So within the system, it matches our typical terms and conditions for data. So whatever, I'm not as familiar with those as you probably are, but whatever our typical T&Cs are, Scribble agreed to. So we are operating under that parameter.
Okay.
One of our districts, Alpine District, when we first put this out there as being available, it's the first question I got back from in an email was, have they signed a data privacy agreement? And fortunately, it's a part of the contract. It's already built into the contract of those standard terms and conditions. And so, yes, they have, and they honor all of those, they knowingly know that. So, and that satisfied the district as well.
Okay, it's the third-party stuff that makes me nervous of sharing of data, even if it's not, anyways. Can I keep asking a couple questions?
You have two more?
I think I have three. But what technology is needed? In other words, do our districts have the technology to do what they need to do with this? Or are people not accessing it because they're lacking in the technology that's needed for this? I'm just wondering on the technology.
No, this one is actually really easy. We have probably now over 500,000 Chromebooks out there just for student use. It runs on all Chromebooks. And it runs on Microsoft platform. It also runs on the Apple platform. So as long as they have a computer, that's all they need. And they're logging into the program through whatever method they might be doing, such as we mentioned Clever or some other single sign-on way to be able to get into the program. No, the barrier is not the technology with this one at all.
Okay, and then two real quick here. Parent access or transparency of content, is that the access of the content being used in the classroom?
Honestly, knowing, and maybe I'm not sure that. I see that Whitney, Dr. is joined with us.
Hi, this is Whitney Phillips, Chief Privacy Officer here. I wanted to point out that section 11.4, let me find the exact wording, relates to parental access. And it does say, I'm scrolling through it right now, specifically, where are you? I just had it. Oh, you're going to have to wait a minute. It basically says, here it is. I want to read it verbatim. Parent access. The parent or legal guardian of a student may access, correct, update, change, or delete the student's personally identifiable information at any time via the student's account settings.
Okay, So curriculum, that, or, do you know what I'm saying? Access to content?
So in order, I don't think there's a parent login. We could actually probably ask on that, but they could go through the student to look at the content. So just logging in and being able to see it from the student viewpoint. I don't know that we've set up parent logins, but we could talk to them about that. The difficulty is what we've done right now is by domain, which is like the school district email address,
Right.
and parents don't have school district email addresses. So that could be a little complicated, but they could obviously go
I
through
guess
the
if
student
someone
one.
were interested, they could.
Absolutely. Oh, yes.
Because most
Simple answer,
won't be,
yes.
but there will be some. So, and then the last component is, the last contract had built into it training with this. Is that the same, will that be the same thing or not?
So we'll have training built into this one as well, knowing that we had 1,200 teachers kind of started this year. We have further development to go, and so we have kept the professional learning availability of options in there so that we can meet the needs of educators.
Okay, thank you.
Thank you, Board Member. Thank you, Board Member Earl. Board Member Cannon?
Will you, the chair accept a motion?
Yes, I will.
Okay, I move that the board approve a 2-year statewide contract extension for Scribble for $1.5 million.
Second, Board Member Booth. Any discussion to this motion? Let me just see, do I have, yeah, you're next. Board Member Klein?
Well, I just have one more question before I feel comfortable voting on this.
Is it to this motion?
No. Her motion is to vote on it. I have another question about the actual
Her motion
agreement.
is to approve the statewide contract.
You're okay.
Does that fall under it? If I have another question.
Well, we'll see if it does. And then I'll tell you if it does. How about-
Okay, so my question is regarding the libraries that are collected by the teacher and student. I had a parent talk to me the other day about assignments that her students were supposed to be doing, and the student wrote a paper that was not at all reflective of the family's values. And so the parent asked and said, why did you write this? And she said, well, I had to use certain resources, otherwise I would be docked. So she had to use the liberal sources. So my question is there a way to keep, again, it comes back to the political neutrality, right? Is the teachers going to stack their library with the articles that match their political ideology, or and when you say fact versus opinion, is that if the students' political opinions don't match the teachers, does the teacher say that's not an okay source for you to use? And that's my question: is there some kind of protection involved so that there is the diversity of thought is protected?
So I don't know if Naomi wants to answer that. Because in my clarity on this, the student can put in sources and so can the teacher. So help me here as to this question for us to approve this contract.
Yes, they, a student can, so if a research topic is given, as, given the example, obviously the teacher obviously has I'm assuming the rights to be able to say, I'd like you to look at these resources. It does not stop a student in using the Scribble tool to just those resources, because they could easily then say, well, I would, perhaps because of their, their viewpoint, and they could present additional evidence. And I would hope that, any teacher would be open to that kind of,
Okay.
to that kind of dialogue with the student,
Yeah, just a quick follow-up. So does Scribble have their own fact checkers per se?
No.
Okay.
No. No, the fact checking is done by the student, by the teacher, bringing those resources together.
Board Member Hanson?
I'll speak in favor of the motion, but also just in 2 years, we have a cliff coming if we expand this and get everyone using it. So I hope that in the meantime, we're doing all the groundwork that's necessary so that we don't leave teachers holding the bag. We're going to invest a lot of time in training, get a lot of people really enthusiastic about this, and then, something good needs to happen going forward.
Thank you, Board Member Hanson. Board Member Hart?
Yeah, I speak in favor as well. I have colleagues that use this. I would ask that the professional development be not just videos, and because it is somewhat complex. It's not a plug and go, which is why it's so good. But that was a significant barrier. In fact, it kept teachers from utilizing it. So I'd ask that the PD be multimodality and way more robust. I completely understand why it was video oriented, and I applaud you for introducing something in the middle of COVID. But I am definitely in favor of having this tool. Look forward to using it.
Seeing no more lights, the motion on the table is that the board approves a 2-year statewide contract extension for Scribble for $1.5 million. All in favor say aye. Aye. Any opposed? The voting is unanimous. And glory, hallelujah, we get to have lunch. Okay, so let's. Let's be back in our, back here at 2:20 sharp to start. No, it is 10 minutes longer? We only have 30 minutes? Okay, then let's be back in our seats, ready to begin at 2:15. 2:15. Thanks. Oh, the lunches are in the admin room.